Hello, and thank you for viewing this webcast. Many of our parents come to us wondering how in the world we can look at a child's eyes and know if they need glasses. They are curious to know if they can't communicate, how can they tell us better one or better two? This webcast is designed to give parents and children an idea of what to expect during an initial visit, how long it may take, why we have to use dilating drops, and how we know if your child needs glasses. Your child will likely be seen by technicians, possibly orthoptists, and your doctor during your visit.
From birth to around 4 to 6 weeks of age, we judge visual behavior initially with how infants respond to bright lights. From 2 to 3 months of age, infants will start to look at and follow faces, toys, as well as bright colored lights. After 6 months of age to about 2 to 3 years of age, we test their visual behavior by observing their tracking, their fixation patterns, as well as having them match pictures or letters if they can. When your child is old enough, we start to have them match pictures or letters. This allows us to attach a number value to their vision and can happen as early as 2 years old sometimes. By alternate covering your child's eyes, eye movements and any misalignment are examined. This can be assessed in children of all ages. We also test stereo or 3D vision in verbal children. This gives us basic information on how your child's eyes work together. We can check eye pressure a number of ways. Some ways require eye drops to numb the eye. A special tool we use, the eye care, does not require drops and most importantly does not hurt. Typically, if this is your first visit, your child will get dilated with dilating drops. Drops are placed in each eye and it generally takes about 30 to 60 minutes for the drops to work. It is often difficult for a child to get eye drops. Many times we have to hold children still and help them open their eyelids. The drops will sting for about 10 to 15 seconds, sort of like getting splashed with swimming pool water. There are 2 reasons we give drops during our initial and yearly exams. Number 1 is to be able to look at the back of the eye, including the optic nerve and retina. And number 2, to relax your child's focusing power to get the best idea of their need for glasses. Without dilation, a child can continually adjust their focus power. This is like trying to measure a child's height while doing jumping jacks. During this time, you may be asked to sit in the waiting room or a special dilating area. Expect your child to start having difficulty reading or looking at near targets during this time. After the 30 to 60 minutes it takes for the dilating drops to work, if they are old enough, a photograph is taken that estimates your child's focus power with an autorefractor. Then, using a special flashlight called a retinoscope and a set of handheld lenses, we can determine the refractive error in babies and young children without their needing to give any input. Older children can have their vision checked through a device called a Phoropter. This device also determines the refractive error. While almost everyone has a small amount of farsightedness, nearsightedness, or astigmatism, that doesn't necessarily mean a child needs glasses. Using these results, we can also predict if your child may need glasses in a few years. Finally, we look at your child's retina and optic nerves using a lens and a light source. We use the same slit lamp machine in children as we do adults to examine the front of the eye. Most kids can sit by themselves on their knees or in their parents' laps. For very small babies, we use a handheld slit lamp. Generally, you can expect the visit to last from 2 to 2.5 hours. Most places will offer sunglasses on the way out, as bright lights may bother your child's eyes after the dilating drops. It is safe for your child to return to school after a visit, but be sure to tell the teacher their eyes will be blurry for a few hours after the drops. Depending on your child's eye color, the dilating drops can keep the pupils dilated as long as 24 hours, so don't be alarmed if your child still seems dilated even the next day.
Remember, there may be some variations between offices or doctors, and not every visit will require dilating drops. It is okay to always ask questions during the exam. We want you to feel comfortable with what is being done to your child. We hope this video helps. Please feel free to share this video if you know of any other parents or children with questions about their eye exam. Thank you.